Brandy. I'll be doing my wound care video today for you guys. Let's go. So first I will knock on the door, hand hygiene. Hi, my name is Brandy. I'll be your student nurse today. Can we start by identifying who you are to verify we have the right orders for today's procedure? Okay, Mr. Jones, can you tell me your date of birth? Okay, I'm gonna verify orders. Looks like the doctor wants us to do new dressing change for you, which will consist of me removing the old dressing, cleaning the wound, and providing a clean dressing for you. This is to make sure that you don't catch any type of infection and that the wound heals properly. So is it okay for me to go ahead and do this procedure today? And do you have any questions for me before I begin the procedure? All right, sounds good. So how's your pain level today from 0 with being no pain to 10 being the worst? Okay, we'll get you some pain medication for 30 minutes before we start the procedure. Give it time to work so you're not in so much pain while we're dealing with this wound today. And do you have any allergies that I need to be aware of? No allergies? Sounds good. Okay, let me gather my supplies. So I have with me a dressing change tray. I have some sterile cotton tips and a pair of regular clean gloves. So what I'm going to do is I'm going to raise the bed to my hip level to make sure that I am in good body mechanics while I'm working with my patient. I'm going to perform hand hygiene before I begin. And I'm going to put on my clean gloves. Okay. So here's my Laridol with my wound. So I have everything here. So the first thing I'm going to do with my clean gloves is I'm going to remove the old dressing. And as I'm removing the old dressing, I'm going to check for any color, any odor, any discharge, the consistency of the discharge, and how much is it. And my patient has a clean dressing, so we're just going to toss that in the trash. And I'm going to look at his wound. I'm looking for eschar, seeing if I see any tunneling, which I do not. Any undermining, which I do not. And at this time is when I will gather dimensions and measurements of my wound. So with my sterile gauze, I'm going to open it with just my tips exposed. I'm going to grab one of these sterile Q-tips, and I have a measuring device on my packaging. So at this time, I won't be touching the wound. I'll just be hovering over the top of it. So I'm going to use pretty much the tip as one end, and I'm going to try to use my fingers to get as accurate of a measurement as I can. So this one, it looks like it's about 2 centimeters in width. Then I'm going to hover over the top for length. Okay, I'm gonna say about 11 centimeters in length. And I do not see any tunneling or undermining, but if I do, I would throw that Q-tip away and I would get a new Q-tip, and I would go down for depth. And usually the wound will leave me some type of marking on my Q-tip, and then I will measure. And with a new sterile one, I will go into my tunneling and see how far my Q-tip goes in for tunneling, and then measurement. And every time it's a different spot for any of those things, I will get a new sterile Q-tip for that. So I'm gonna put these back because I'm gonna need these later in my, so we're gonna have somebody else, my imaginary assistant, help me with that. So after I did all my measuring and everything, I disposed of all of those into my appropriate bio bag that I got over here. And then I'm gonna remove these gloves and put them in trash. And I'm gonna do hand hygiene again. And at this point is when I'm gonna don my PPE. So I'm gonna put on my gown. Well, not gown unless it's isolation. I'm gonna put on a mask, protective eyewear or shield in case there's any splashing or debris that pops back at me while I'm doing irrigation or anything. So I'm gonna come to my sterile tray, and I'm gonna open it away from me. I'm going to set up my sterile base and make sure I do not break sterile field. Okay, so then I'm going to grab my gloves in the clean area. Yeah, in the clean area, I'm going to open away and stain in the outer borders and open away. And then I'm going to pinch the outside of my glove and go in. Did they rip? Okay. Yeah. I will get a new pair of gloves because these ripped, but I don't have it anymore. And then I will cuff and come in here. And then this is my trash. And then I will take this is a little trash bag for me. And then I will pour my sterile solution into my tray. And then I will bring all my stuff outer for my dressing. So I'm gonna soak about 4 or 5 of those into my dressing, into my sterile saline for my dressing. And then if I was gonna do irrigation, I would take probably a 60 milliliter syringe. I will draw up my solution and I will come to the wound, and in one direction I would irrigate downwards until my solution runs clear. And once it's clear, then I will take a pair of gauze and I will pat the excess away, getting a new gauze every time I'm patting to get everything clear. And then once I'm done with my irrigation and cleaning and patting and everything, I will not use those gauze anymore. They'll be put in trash. And then I will start to do my wet to dry dressing. So I will have my assistant come and help me open up a gauze. Hi. Can you open up some sterile tips for me, because they did not come in my sterile tray. So with my assistant holding it open like this is when I will grab, but she will not be over my sterile field. Off to the side, I will grab a Q-tip. And at this time is when I want to take my wet dressing and one gauze at a time. I'm going to take my wet dressing and I'm going to use my Q-tip to guide my gauze. And I'm going to apply my dressing into my wound until it's level with surface. Okay, and then I will apply, this is trash now, and then I will apply dry gauze over the dressing, and then I will apply my ABD pad over my dressing, and then with my tape I will secure it. I'm just gonna imagine tape it in a window pane type of manner, and I would label. I'm done with everything that needs to be sterile at this point because she has a clean dressing on, and because I don't want to touch my ink pen with dirty gloves, I'm gonna take my gloves off, perform hand hygiene. I'm gonna label my dressing and place it on my dressing. At this point, I'm going to ask the patient again about their pain level. So on a scale from 0 to 10, how was your pain? Good, no pain. I wasn't trying to cause any for you. So patient has no pain. I'm going to bring my side rails back up. I'm going to lower the bed to the lowest position. I'm going to make sure it's locked. I'm going to give you your call light in case you need anything, okay? And I want to thank you again for allowing me to do this dressing on you today. If you have any discomfort, pain, or any needs or concerns, don't be afraid to give me a call. Hand hygiene, thank you, goodbye.